Today. We're excited to be here and talk to you about the public health guidelines in reopening Ontario framework. So, as Lindsay stated, my name is Stacey Hawkins. I'm one of the public health inspectors at the St. Thomas Elgin site, and then my colleague Christina McCarthy is also with us, and she's a public health inspector at the Woodstock Oxford site. So we just want to give you a bit of a disclaimer here that this presentation is based on the current requirements within the framework. So if the framework does change in any way, the most up-to-date framework must be followed. If you have any questions, if the framework does change at any point, you can always reach out to the health unit and we'll do our best to support you in your business, okay? So some topics that we'll be discussing today include a brief overview of the COVID-19 response framework, the face covering requirements within workspaces for employees and patrons, screening requirements for workers and for customers in the workplace safety plan requirements, how we can support you through the pandemic, a brief outline of how public health inspectors are involved in enforcement, and then we're hopefully going to be able to answer some of the specific questions that you sent off to us as well. So for the COVID-19 response framework, Southwestern Public Health moved into the framework starting February 16th at 12:01 a.m. The details of the framework are available on the ministry website on the COVID-19 response framework, Keeping Ontario Safe and Open channel, and they're also available on the link that's on the slide there. So this framework is based on color levels that each health unit region is put into and is dependent on the local situation. The local data that plays a role in determining which color level each region goes into includes the weekly incident rate, the percent positivity to tests, outbreak trends, and the level of community transmission. The different colors within the framework include green for prevent, yellow for protect, orange for restrict, red for control, and gray for lockdown. As you move through the colors within the framework, the restrictions do get greater. So each color level does have different regulations that apply. For example, when you're in the green, yellow, and orange levels, they all fall under the Ontario Regulation 364/20. The red level falls under the Ontario Regulation 263/20, and the gray level falls under Ontario Regulation 82/20. The color level that Southwestern Public Health is in can change on a weekly basis as per the provincial Ontario government's directions, which again, it corresponds with any local data changes that we have in our region. For the most up-to-date information on what color level Southwestern Public Health region is in, you can visit our website at www.swpublichealth.ca. As of February 16th, the Southwestern Public Health region is in the red or control level, which means that at this time, the Ontario Regulation 263/20 is the legislation that has to be followed. On October 2nd of 2020, the province of Ontario mandated face coverings in all indoor areas of businesses or organizations. This requirement must be followed regardless of what color level the region is in, and the Southwestern Public Health also has a letter of instruction that went out that reiterates this information and the requirements for face coverings. So face coverings are required in all indoor and some outdoor public spaces. Face coverings must be worn by all employees and patrons in all indoor public areas. This is required even if there's a physical barrier in place. So for example, if there's an employee that's standing behind an impermeable barrier at a checkout counter, so like behind plexiglass, the employee would still have to be masked. For outdoor public spaces, face coverings are required at any time where physical distancing cannot be maintained from people outside of your immediate household. So some examples that might be within a workplace of an outdoor space could be in construction areas, or if you're participating in pick your own farmers market spaces. Face coverings are also required in outdoor areas in addition to making sure that you're maintaining physical distancing when you're waiting in a line outside of a business. So that could be if you're waiting outside of a restaurant or a retail store, you need to make sure that you're also wearing your face covering. There are some limited exemptions to face coverings, which include individuals that are under the age of 2, medical reasons, if you're unable to put on or remove your mask without assistance, accommodations that need to be made under the Accessibility for Ontarians with Disabilities Act. You can temporarily remove your mask while eating or drinking or when you're engaging in physical activity. I'm sure one of the ones that most people are interested in is employee-only spaces, but essentially it is only exempt when you're able to maintain physical distancing of 2 meters from every other employee in that space. So some examples of these employee-only spaces could include office spaces, warehouse areas, and kitchens in a food premise. For a more exhaustive list of exemptions, we do have additional information on our website, and we also have posters that you can provide and post in your business. And that will be at www.swpublichealth.ca/face coverings. It's also important to note that proof of exemption is not required from patrons or employees who are exempt. So if anybody says they meet the exemption criteria, it is based off of the good faith. So things that would make a face covering acceptable, essentially it needs to have at least 3 layers. It needs to be large enough to completely and comfortably cover the nose, mouth, and chin and fit snugly around the cheeks without any gapping. It needs to fit securely to the head with ties or ear loops. It needs to keep it safe after you've washed or dried it, and it shouldn't have any valves or vents or be made of hard plastic. So to move further into that, there are some points where you might need to wear a medical mask or even a medical mask and a face shield. So some of those times would be in some settings that you're providing personal care services, when you're providing services that create aerosols, or when employees are required to be within 2 meters of someone without a face covering. So that could be when a server is providing food or refills on drinks to people sitting at the table in a restaurant, or when you're providing services where the mask is temporarily removed, so when you're doing beard trimming services. It's important to note that sometimes you may also need additional precautions, so a medical mask and face shield might not be enough. This would be when you're a healthcare provider and you're providing services or care to somebody who is tested positive for COVID-19 or who has symptoms for COVID-19 and you're waiting results. You would need to have droplet and contact precautions. So that would essentially mean that the personal protective equipment you have to wear would be a medical mask, a face shield or goggles, gloves, and a gown. It's also important to note that plastic face coverings do not fit the requirements because if they were to fit properly, they would cause a health concern. You're not able to breathe through them appropriately. So if you run into any concerns with people that are coming in with face coverings that are strictly made of plastic, we would recommend trying to have alternate options available for them and kindly request that they're using your option rather than the one that they came to your workplace with. So for employer requirements, the main ones are just making sure that you're training employees on proper use, removal, and washing of face coverings. You're providing a sufficient supply of face coverings for your staff, and you could consider having a supply for customers as well. Have a clear policy in place for employees to follow, and make sure that it's following the Southwestern Public Health letter of instructions. Train staff on how to implement the provincial face covering regulations and how they're going to manage any individuals that claim exemptions. It's also important to make sure that you're posting signs at all the entrances to remind customers of face covering requirements, outlining any policies that your business may have regarding face coverings, and you could consider posting some of the exemptions on the door. So we have created a few scenarios regarding frequently asked questions that Southwestern Public Health has been receiving regarding face coverings. So the first scenario I have is an employee has a face covering exemption. So essentially the employer cannot demand proof of the exemption, but should make alternate accommodations for the employee. So this could include having them work from home, having them work in an area separate from the customers, or an area where they're able to physically distance from others, or you could consider face shield as an alternative. This is something that you should be working with the Ministry of Labor or your health and safety representative just to make sure that that employee is able to stay safe. For scenario 2, a patron enters the workspace without a face covering. So if you have anybody that's coming in, essentially the first step is always to kindly remind the patron of their requirement to wear the face covering. If that patron states that they meet the exemption criteria, they would not be required to wear the face covering. Now, again, businesses, you cannot require proof for that individual to explain why they are exempt. And we would recommend, if possible, providing alternate accommodations to that person. So if you can do curbside pickup or delivery for them to still have your services or do business with you, that would be a great alternative. And I know some businesses are choosing to look at the no mask, no service policy. If you are, we recommend that you make sure you're reaching out to your legal counsel for further guidance and just make sure you're within your rights. For scenario 3, a patron enters your workspace without a face covering. Again, you kindly remind them that they need to wear their face covering, but they are claiming that they didn't meet the exemption criteria, but they just refused to mask. So if you are choosing to provide face coverings to customers when they come in, you could offer to provide one that you have available, or again, you could offer alternate accommodations. Now, if the patron refuses to mask, does not have an exemption, and refuses to leave your premises, then we would recommend that you contact local police for support, and they'll be able to assist you with any enforcement strategies. And for the final scenario here, a patron enters your workspace with a face covering made out of plastic. So kindly remind them that that does not meet the requirements of an acceptable face covering. If the patron says that they are exempt, this could potentially be considered something that you could use an alternative or in lieu of a face covering. But again, that would be something that we recommend businesses create a policy on and to determine how they're going to approach such situations. If a patron notes that they don't have any other options and that plastic mask is all they have, then you can look into, again, if you do have masks available or other face coverings available to provide to customers, you could offer that to that patron, or you could look at alternate accommodations like the curbside pickup or delivery. Or if the patron just flat out refuses to wear an acceptable mask and does not say they meet the exemption criteria, then they're not in compliance with the requirements. So you can kindly ask them to leave and you can do alternate accommodations. Or if they're refusing to leave and don't want to do the alternate accommodations, then again, make sure you're reaching out to local police for support. So for moving along to screening requirements within workplaces, every color level of the framework, all employees must be actively screened before they start their shift. So active screening requirements of employees, they must answer specific questions that are in the screening tool. So questions that have to be answered can be found on the ministry website or in the link that's on the slide there. So covid-19.ontario.ca/screening/worker. So this screening can be done verbally, online, on paper, or the employer can direct all employees to make sure they're completing it before they come in for their start of their shift. We do recommend that a record is kept of the results and that they're kept for at least 30 days, just in case we need to do any contact tracing within the workplace. Now, screening for patrons is a little bit different. So there are two different ways that patrons can be screened. Passive screening, which would be posting a sign on the door, or active screening, which is similar to what we outlined in the employee screening, except there are separate questions that are required for patrons. Again, that can be found on the ministry website. Similar link, the covid-19.ontario.ca/screening/customer. At a minimum, in all color levels, all businesses are required to passively screen. There are certain businesses within certain color levels, though, that do need to actively screen patrons, which we do have outlined on the next slide. So this table outlines when active screening needs to be done for patrons in what businesses or organizations. Active screening tools must contain all of the required questions that are outlined in the link below. Again, similar to all of the required questions for the employees. And if anyone fails the screen, they must be denied entry to the business or organization, and they should be advised to go home, self-isolate, and contact their healthcare provider, telehealth, or their local public health unit for guidance on assessment and the need to go get a COVID test. And now I'm going to pass it on to my colleague, Christina, and she's going to go over the workplace safety plan.
Hello, my name is Christina. I'm also one of the public health inspectors here at Southwestern Public Health. So we are going to discuss the workplace safety plan. So all workplaces are required to have a workplace safety plan. This plan is essentially a checklist that outlines items that you need to consider to mitigate the risk of COVID-19 within your workplace and allow for a safe reopening. The workplace safety plan must be in writing. It must be made available on request. So if the health unit requests, it must be made available to us. As well, it has to be posted in a conspicuous place where it's available to both employees and customers if you have any customers. As well, the plan must describe the measures and procedures that we put in place to reduce the risk of COVID-19 within your workplace. Items that must be included in your workplace safety plan include screening, physical distancing, masking and or face coverings, cleaning and disinfecting, which should be conducted at least 2 times per day or more often as necessary. As well, the workplace safety plan would need to include any personal protective equipment if that's applicable to your workplace. So prior to reopening, it's important for all workplaces to ensure that the workplace safety plan is comprehensive and complete to accurately reflect the measures that your business or workplace has in place. If there are different measures for different departments and within your workplace, this should be reflected in the plan. As well, if your business has multiple different sites or locations, the different measures at each site should be reflected in the plan and tailored towards that workplace. To assist workplaces and employers, the Government of Ontario has created a template for how to create this workplace safety plan. This template is available through the link at the bottom of the slide. So www.ontario.ca/page/develop your COVID-19 workplace safety plan. This template, as you can see, it includes all the measures that we previously discussed. So, for example, in your workplace safety plan, you would need to include how you will meet the screening, physical distancing, cleaning and disinfection requirements, as well as if there's any personal protective equipment that is required. So now we're going to talk about how Southwestern Public Health can support employers and workplaces. Our COVID-19 information webpage has resources for various topics, which include community settings, schools and childcare centers, workplaces and employers, healthcare providers, and face coverings. Our workplace webpage provides general information as well as information specific to various workplaces for each color level, and it's available at the link on the page here. So the workplace webpage covers the various topics, so retail settings, food premises, personal service settings, fitness facilities, taxi and ride shares, as well as information for seasonal farms. Our workplace webpage also contains information for where businesses can go to receive financial relief. If you have any questions related to COVID-19, we recommend that you contact our COVID-19 Response Center at 1-800-922-0096, extension 9. We currently are not answering live calls, so if you leave a short message detailing the reason why you are calling and clearly state your name and your phone number, a member of our response team will contact you back within 24 hours. Each call is important to us, and we look forward to supporting you and providing information and doing this in a mutually courteous and respectful manner. Our response center is open Monday to Friday from 8 a.m. till 5 p.m. and Saturday and Sunday from 8:30 a.m. until 4:30 p.m. If you are an inspected premise, such as a pool, a food premise, a personal service setting, or other, you can reach out to your local area public health inspector for guidance. So if you know who your area inspector is, feel free to reach out to them. If you do not know who that inspector is, you can call our 1-800 number. So that's 1-800-922-0096 and request to speak with your area public health inspector. You'll be required to provide information on where your business is located. This is so that our program assistants are able to direct you to your local area inspector. As well, you could email us with any inquiries, and your area inspector will get back to you. Again, noting where your business is located so that it can be directed to the correct public health inspector. Our email is environmentalhealth@swpublichealth.ca. Businesses who have questions about closures of at-risk workplaces or how emergency measures impact their business or employment can call the Stop the Spread Business Information Line at 1-888-444-3659. One other thing that Southwestern Public Health has to support businesses is we have a workplace team that follows up with businesses when they have more than one positive case that's linked to that workplace. So our team will work to ensure that individuals who are close contacts are isolating. As well, the team will work with management to ensure that appropriate control measures are put in place to mitigate the risk. Dr. Locke also provides updates on every Wednesday. She discusses various information from vaccine information, and it's also an open forum for general COVID-19 questions. We recommend that you check that out. There's lots of great information in there. So we're going to talk a little bit about enforcement and how our public health inspector team conducts issues with non-compliance. So Southwestern Public Health has an enforcement team that ensures compliance with the reopening framework. We also work with community partners to ensure that the requirements are followed. Some of our partners include municipalities and bylaw officers, police officers, Ministry of Labor, and the list goes on. Uh, Our enforcement team uses a progressive enforcement approach. In doing this, we make every effort to be fair, transparent, and consistent. Our approach is streamlined and focused to ensure that it is effective. Uh, our approach is compliance based. We make every effort to ensure that people are following the requirements. Our approach is also risk based. We look at the overall picture when trying to gain compliance. We look at what is the risk to the public. As well, we focus on getting the desired outcome, which would be getting compliance with the requirements and ensuring that the risk to the public is mitigated. To gain compliance, we have several tools in our pocket. One piece is education. We make every effort to ensure that we provide education so that people are able to follow the rules. We also have the ability to issue tickets and summons. Tickets are able to be done on the spot and it's a set fine, and summons are a requirement to appear in court at a later date, and this could result in higher fines. We are flexible in our approach, and our response is proportionate to the level of risk and circumstances. Generally speaking, we do try to do education first. For example, if we are interacting with an employer or a business owner regarding a complaint, we received about a lack of a workplace safety plan, our response would likely be education first. We would provide supports where needed for the employer to be able to complete this task. However, if we receive multiple complaints or during further follow-up with a business and they have not made the necessary changes after the education and resources were provided, we may proceed with next steps. In certain scenarios, depending on risk and circumstance, there may be a need to move forward with tickets or summons as a first step. This does not happen often, but it does happen. Typically speaking, the scenario is extreme. For example, if while we are on site, it's determined that education is not likely to achieve compliance. So the operator or employer might outright refuse to follow the rules, and maybe they're instructing other employees and patrons to disregard the rules as well. In this scenario, a ticket or summons may be the next step. Our goal is always to achieve compliance in the end.
Sorry, I forgot to take myself off mute. All right, so now we're just going to go over some of the questions that you guys have submitted to us prior to. So bear with us because there is a fair bit of information. Now, some of it is going to be very specific to the questions that were given to us, but it is important to note that everything in our presentation is essentially the starting point. So you do need to have that workplace safety plan and all of the requirements within the workplace safety plan that you're following, in addition to these answers and information that we're providing to you. So some of the questions that we received did surround meeting rooms. There we go. So the specific questions that we got were around just whether there's different guidelines or not for gathering, when such meeting spaces will be able to be open, and when in-person meetings of certain sizes can start again. So there are different requirements for meeting spaces that differ from the gathering restrictions. So in the chart on the slide here, it goes over what the capacity limits are for each of the different colors. So for green, as long as you're able to physically distance in those meeting rooms, you can have up to 50 people indoors and 100 people outdoors, but you cannot have multiple rooms that you're booking for the same meeting or the same event. For yellow, It's a similar situation. So again, you need to be able to make sure you're physically distancing, and you can have up to 50 people indoors or 100 people outdoors. You are required to make sure that you're collecting any information from everybody that attends the meeting. You can only have up to 6 people sitting at the same table. And if you have any music playing, it needs to be low enough that a normal conversation can be made. For orange, very similar to yellow, the only difference would be that there's a limit of only 4 people that can sit at the same table. For red, the capacity limits do lower significantly. Again, it is based off of physical distancing, so you need to make sure that you're able to physically distance, and you cannot have any more than 10 people indoors or 25 people outdoors. And you can only have a maximum of 4 people sitting at the table at a time. Now for gray, the meeting rooms do need to be closed. There are limited exemptions where if you have those spaces available for childcare services, court services, mental health and addiction support services, etc. So the question about when you can reopen your amenities specific to meeting rooms can be open in green, yellow, orange, and red levels with restrictions as outlined. The meeting rooms in gray, however, do need to be closed, again, with those limited exemptions of when they can be available to people. And for the 15-person board meetings, when can they resume in person? That would be something that can be done indoors in the green, yellow, and orange stages, but could be done outdoors in any of the stages. Again, physically distancing does need to be maintained. We also received some questions surrounding pools. So when pools would be able to open and what regulations indoor pools would have to follow. So for pools, they are able to be open in green, yellow, orange, and red levels, as long as the place of business is able to be open to the public. Now in gray, regardless if your space is able to be open to the public or not, the pool must be closed. In terms of the regulations that the indoor pool has to follow, pools have requirements that are under the Health Protection and Promotion Act for the Ontario Pool Regulation. And then there's also the Reopening Ontario framework that they need to follow. So we would recommend that if you have a pool that you're wanting to open up, you reach out to the local public health inspector for more information, mainly because if it's been closed, it does need to have a pre-opening inspection done before you can open up.
All right, so we received a question regarding community centers and regulations that would apply to a retirement village community center. So I just want to start by saying that it was our assumption in answering this question that it was in regards to a community center that was geared towards individuals who are retired, not a recreational center that is in a retirement home. If the center is in a retirement home, they would have additional or alternative requirements and would need to follow guidance regarding retirement homes. So with that moving forward, we're taking the approach that this is a community center that's geared towards individuals who are retired. So retirement homes, so this type of community center would fall under the same requirements as other community centers. Community centers are able to open with restrictions, and the restrictions are dependent on which color level the region is in. This chart here shows requirements related to capacity and distancing at different stages. You might notice that it only covers green, yellow, and orange. That's because there is a lot of information and I could not fit it all on one slide. So the red and gray are on the following slide. So for right now, we're just going to be looking at the green, yellow, and orange stages for community centers, and then we'll cover the red and the gray. So in the green stage, community centers are able to open as long as there's physical distancing of 2 meters unless engaged in sport. Community centers have a capacity limit for each room that's physically separated from others in the facility. So for each room that's able to be separated, you would be able to have 50 persons for an indoor class, program, or organized activity, 100 persons for outdoor classes, programs, and activities, and 50 persons for areas that contain weights or exercise machines. Again, keeping in mind, these are the maximums, and it's still, people are still required to be physically distant. In the yellow stage, the requirement for physical distancing extends to 3 meters, and community centers have a capacity limit for each room that is able to be physically separate from others. For each room that's physically separate, you'd be able to have 10 people for an indoor fitness or exercise class, 25 people for outdoor fitness or exercise classes, and 50 for people who are in areas with weights or exercise machines. The requirements in the orange stage are the same as the yellow stage. So now we'll move on to the red and gray requirements. In the red stage, community centers have a capacity limit, again, that is for each room that's able to be physically separated from other rooms in the facility. So 10 people for an indoor class, class, organized program, or organized activity, 25 people for outdoor classes, organized programs, or activities, and 10 people for areas that contain weights or exercise machines. In addition, every person using an area must have a physical distance of at least 3 meters from every other person. In the gray stage, community centers are only able to be open for very specific purposes. So this includes for a day camp for children, if it's a provider of a child care service within the meaning of Child Care and Early Years Act, if the community center is providing mental health support services or addiction services, as long as no more than 10 people are permitted to occupy the space, as well they're able to open for the provision of social services. There are other requirements that community centers are required to follow. In this chart here, we just focused on capacity and distancing requirements. Community centers as well may have different services that they provide that would have additional requirements. For example, if they have pools, we would recommend that you reach out to your local public health inspector for more guidance on the requirements for your specific premise. We receive questions regarding retail establishments. So when is retail able to open in Oxford County? What is the capacity for customers? And if a business is essential, is the store able to open to the public during lockdown? So as you can see here, we have another chart just outlining what the requirements are for retail in various stages. So when can retail open in Oxford County? So in the Southwestern Public Health region, which includes Oxford County, Elgin County, and St. Thomas, retail is permitted to open in all stages of the color-coded framework with restrictions in place. And the restrictions are dependent on which stage we are in. For further details, we do have a guidance document on our website under workplaces that goes into detail for retail establishments. It has lots of great information, and if you have a retail establishment, I would absolutely recommend taking a look at that. So we're just going to quickly go through the chart here. So in the green stage, stores must have a passive screening for patrons. So that would be the signs in the storefront at all entrances, and not entering if they have COVID-19 systems. Fitting rooms must be limited to non-adjacent stalls. As well, the venue must manage lineups and patrons who are congregating outside. So stores, if you have a lineup outside, you need to ensure that they're distancing 2 meters and that they are wearing face coverings. In the yellow stage, stores must limit the volume of music so it's low to a normal conversation level. That's so that people aren't shouting and speaking loudly. For malls, a safety plan is required to be prepared and made available upon request. In the orange stage, indoor malls are required to do screening in accordance with the instructions by the Office of the Chief Medical Officer of Health. So that would include active screening. In the red stage, a capacity limit of 75% for supermarkets or other stores that primarily sell groceries, as well as pharmacies, and 50% capacity limit for all other retail stores. And that could include discount and big box retailers, liquor stores, hardware stores, garden centers, etc. Stores must post the capacity limit publicly, and malls must ensure that interior dining spaces are closed. That includes any tables and seating. In the gray stage, in-person shopping and retail is subject to the capacity limits of 50% for supermarkets and other stores that primarily sell groceries, as well as pharmacies are at that 50% capacity limit. There's a 25% capacity limit for all other retail stores, and curbside pickup and delivery are permitted, and there's no loitering permitted in shopping malls and in stores within the malls, subject to appropriate retail measures. It's important to note that the different capacity limits, so the 25, 50, and 75% are, there is a specific oh goodness, there's a way to determine what the capacity limit is, and that is included in our retailer guide. So again, making sure that you have a look at that just to see what your requirements are to make sure that you are meeting your capacity requirements. Okay, so the question regarding if an essential business is allowed to open during a lockdown. So we just want to clarify that the shutdown was different than the lockdown measures. We were just in the shutdown where many retail stores were not permitted to be open to the public for in-person shopping. However, we are no longer in shutdown as we here in the Southwestern Public Health region have moved to the color-coded framework. The lockdown is also called the gray stage, and it's in the color-coded framework. So in the gray stage, retail stores are able to open for in-person shopping with retail stores limited to the capacity of 25% and supermarkets and grocery stores to the limit of 50% capacity.
So we also received some questions about the guidelines of holistic health services, which we were able to determine essentially any regulated health professional, for example, a massage therapist, can continue to provide services to clients regardless of any color level that you're in. So the general guidelines while providing these services would apply, which essentially again outlines what we went over in the workplace safety plan. There are some specifics, including adhering to wearing face coverings, but note that orange, red, and gray stages, you cannot provide any services where a face covering needs to be removed. In the green and yellow stages, personal protective equipment, including face shields and goggles, as well as the face mask, would be required if you're within 2 meters of someone who is not masked. So that could be for temporary removal, or if they meet the exemption criteria and you're still opting to provide services for them. Other things that would include making sure that you're maintaining records of your clients and keeping them for at least 30 days in case we need to do any contact, cleaning and disinfecting all high touch surfaces, using a disinfectant with a drug identification number, and following the manufacturer's instructions, having hand sanitizer available on site to make sure that you are practicing proper hand hygiene and to encourage other patrons to practice proper hand hygiene. And then we'd also recommend that you're reaching out to your regulatory organization to ensure that you're meeting those requirements because they might have some additional things outlined for you to follow. So we also received a question specific to campgrounds, inquiring about what the conditions for a recreational facility such as a campground would be. So we have another chart, which I'm sure you guys are sick of seeing, but in terms of green and yellow and orange, campgrounds are able to be open. The biggest restriction is just making sure that owners are enforcing the gathering limits to anybody who's using this space. So the gathering limits for green, yellow, and orange stages is no more than 50 people indoors and no more than 100 people outdoors. Again, that is permitting that physical distancing can be maintained. For the red stage, campgrounds are able to be open as long as any locker rooms, change rooms, and showers are closed, unless they need to be accessed because they hold first aid equipment or storage equipment. Any equipment that is rented or provided to patrons must be cleaned and disinfected between each use. And the owner needs to, again, make sure that they're following all the applicable gathering limits. So for red stage, that is 10 indoors and 25 outdoors. For the gray area, the campgrounds are able to be open as long as the campsite is available for trailers or recreational vehicles for individuals who need a house or have a permit for their full-time season contract. Those campsites need to have electricity, water services, and facilities for sewage disposal. All of the recreational facilities and any other shared facilities, so like pools or meeting spaces, need to be closed. And the seasonal campground must be closed to general public and only open for the purposes of preparing the campground for reopening. Now, we do encourage anybody that has a campground to make sure that you reach out to the health unit to see that there aren't any other requirements that you need to meet. For example, if you have a pool, the meeting space, or if you're a small drinking water system. There was also a question surrounding customer spaces. So a scenario was given to us regarding somebody who has a waiting area where 6 customers normally were there, but with physical distancing, they can only accommodate for 4. So generally speaking, businesses are required to make sure that customers can maintain physical distancing. So in this scenario, if they're able to maintain physical distancing with 4 people, that would be considered acceptable. We do have recommendations, however, of making sure that you have signs posted at the doors to outline how many customers can be in that space. You have spacers or some type of physical indicator showing where patrons can sit or stand. And if you have an area with chairs, removing any chairs or adjusting the chairs to make sure that they're 2 meters apart. We'd also making sure that, we also recommend that businesses are scheduling times or appointments for patrons to come in, just to try to limit the number of people that are in the waiting room or to potentially be able to eliminate the need for a waiting room altogether. It's also important to note that if you have a business where there's a group of individuals that are coming in all at one time, so say you have a couple of families that are coming into a restaurant, the people within the families don't need to physically distance from each other, but the separate families would need to physically distance from each other. And then we had another question that was very similar in regards to employee-only spaces and lunchroom spacing. So essentially, it's very similar messaging, making sure that you're able to maintain that physical distancing of 2 meters between any person that is not within your immediate household. So employers could potentially accommodate for this by staggering lunches or shifts to make sure that you have less people that are going into the lunch space. And they can also use the other tools that we went over with customer spaces. So removing chairs, having markings, that sort of thing.
We had questions related to general business questions. So is there an inspection checklist that can be used for each business to adhere to requirements? As well, another question we received was, are there any guidelines for retail and offices and on how often cleaning of high touch surfaces is required? There we go. So in regards to the checklist, if there is a checklist for businesses to use to ensure that they're adhering to requirements, businesses could use the Workplace Safety Plan tool as a guide to address the basic requirements under the COVID-19 framework. We also have workplace-specific guidance documents that businesses could use as a checklist to make sure that they are meeting the minimum requirements. In regards to if there are any guidelines for retail and office spaces on how often cleaning of high touch surfaces is required, we do recommend cleaning and disinfection of high touch surfaces at least twice daily or more often if needed. So in a retail environment, if you are very consistently using something like a pin pad, perhaps after each customer, giving that a wipe down with a disinfectant because it is being constantly touched. When you're using a disinfectant, you would want to make sure that it has a DIN on there, so a drug identification number, and that essentially ensures that the product does what it says it's supposed to do. We recommend checking out our Public Health Ontario's cleaning and disinfection in public places document. They have lots of great information on there on when cleaning is required, what disinfectants to use, and other great information. So that can be found at the link there on the screen. We had questions regarding return to work. Can employees refuse to return to work when a business reopens? So this question is related to an employee refusing to return to work as perhaps they don't feel safe, but it's in relation to worker safety. Therefore, it would fall under the Ministry of Labor. So we would recommend for this question to contact the Ministry of Labor, and their number's right there. So it's 1-877-202-0008. They can go through that with you and provide you with the answer on your specific workplace. So we wanted to thank you for joining us today. We recognize that we have gone through a lot of information all at once. Any additional questions you have at the moment, we will do our best to answer with the time that we have left. If there's any specific questions or concerns that we're unable to answer on the spot, we will get back to you with an answer as soon as we can. In addition, if you have any questions at a later date, please always feel free to reach out to Southwestern Public Health and we will be happy to assist you.
Stacy, I'm not sure if you can see the questions that are submitted in the Q&A box, or would you like me to? There's one in there. Do you need me to read it to you?
I think I do see it here. I'll read it out to Christina as well, just in case.
Perfect.
In case she can't see it. So regarding active screening for gyms, do we have to screen members in real time, or can we have a QR code and Google form they fill in, which gets audited daily and we remove access if the form is wrong? So it's sounding like you have a form already started that you're that you have set up, and the patrons can do this screening that way is kind of my guess on what's going on with that situation. So I would say that would be acceptable as long as all of the members of your gym are aware of that requirement of making sure that they're filling out that form and that code prior to their coming to visit your gym. I hope that answers your question.
And then I'm not sure if Suzanne Rankin is on the call still, but she said she had a question. So Suzanne, I don't know if you want to put it in the chat box, but we could go over that question as well. Yeah, Suzanne, if you could put your question in the chat box, I can bring you on to be able to answer it. Actually, sorry, okay, Suzanne, you can, you're muted now, but if you unmute, you'll be able to ask the question directly.
Okay, thank you. I appreciate that. It's basically a situation that I've seen happen in the area that we live in a few times over the last months with regards to the point of you can't, I believe you can't ask why someone can't wear a mask, but a business is allowed to say they need a mask to come into their premises. But then one of your points said that they need to consult legal counsel if they still want to refuse entry by someone. And then a little later in the presentation, you were talking about massage therapists and the sort of services where someone absolutely has to have a mask. So it's a little bit contradictory. And I guess my point of needing a little bit more information for them so that I can help them is a person's walking in and wants a service given, but they're said, you know, they're told you have to wear a mask, and they say, well, I'm exempt. And they say, the premise business says, I'm sorry, in order to get that service, you have to wear a mask. So they tell the people they can't come in without the mask. So can you just clarify that little bit of gray area? Have I made sense? I hope.
Yeah, I think I'm understanding your question, Suzanne. So there's a couple of different pieces because it is a little bit confusing. But essentially, if somebody meets the masking exemption, like one of the exemption criteria that we have outlined on one of the slides, and it is available in the regulation, then the business would have to determine what they want to do with that. So they would need to have some type of policy that they have in place of whether they're still going to provide that service to that customer or client or not. Now, if somebody came in, does not meet the exemption criteria and just flat out refuses to follow the rules, that would be where enforcement could be made.
Mm-hmm.
Does that clarify your question, or does that give too general of an answer?
Well, it sort of does and doesn't. I mean, basically, it's still a little gray based on the service that this business is providing requires that a mask be worn, like you said, for example, in the massage therapy area. But that person, you know, says they can't wear a mask, and that business is not allowed to prove that, right? So it still becomes a little bit of a gray area. If the person's going to stand there and demand to be let in anyway, then you're saying if it gets to that point, call the police to help you with the situation. Is that what you mean? Or this policy point, sorry, the policy is in our business, you have to wear a mask. So you're saying really, on the other hand, you can say no mask, you can't come in no matter what.
Yeah, the policy piece would come into play in terms of how the business wants to handle somebody that does have an exemption. So if somebody's coming in for a service where they should be masked, or when being in the red zone, how we can't provide services where masks need to be removed. If you have a client or a customer that's coming in that meets the exemption, then that business can choose to still provide that service to them. But again, it would need to be a policy that that business has. If they chose not to provide that service to them anymore, that should also be a policy that they have, just because there's legal implications to that.
Yeah, and policies mean that that's their policy because they're an individual business. They're not a corporation and part of a larger system. Do you know what I mean? So therefore,
Yeah.
that's their policy, and legal counsel, that gets expensive. So there are still a lot of gray areas, right, to follow for people. This presentation has been fabulous, and I wish that everyone could be hearing it. There's so many details.
Well, that's very kind of you. Thank you, Suzanne, for saying that.
Mm-hmm.
Thank you,
Yes, thank you.
Suzanne. So we're just going to move to the next question here. So the next question in the chat box here is, if employees work at multiple businesses, what is the protocol for a positive COVID case if all employees are wearing a mask?
Sorry, I'm just reading the question here. Christina, do you have an answer for this one?
I believe so. So that's something that our workplace team would need to follow up on. So if the person is working in multiple different locations, our workplace team would follow up with that individual or a case investigator, and they would determine who all that individual was in close contact with. So things that they could consider are if people were wearing masks or not. I myself, I'm not certain on if they were within close proximity, so within the 2 feet for greater than 15 minutes. So if that's considered close contact. If they were wearing masks, I'm not certain if that would still be considered close contact or not, but that would be determined in consultation with the case investigator and the workplace team. So they would follow up to determine who all that person was in close contact with, and then those individuals would then need to be going into isolation for the specified amount of time. Does that answer the question?
It sounds like that answer was okay. Thank you. So the next question is employee screening that is done through an online application immediately upon computer login acceptable versus done prior to entering the workplace? It's done by each employee daily upon entering the building, not open to the public.
So this is something kind of similar to what our office has in place as well. For us to complete the screening, we do have to be logged into our server at some extent. Now, if it's a similar screening tool that they're doing every single day with the same questions, as long as you're making it very clear to any employees that you have that they should be well versed on what the screening tool has. If they feel they shouldn't be coming in, then they need to be contacting you before they're coming into the workplace and failing or not failing the screen.
So that's all the questions in the chat box so far, but there's a couple submitted through the Q&A. So the first one we've answered already, and the second one asks, is the limit in the red color for 10 in the entire building? We have several meeting rooms. Can we place up to 10 in each room?
So I know this is something that Christina and I have chatted about. I wonder if this is something that maybe we can look further into just to get complete clarification. Christina, did you have a full understanding of that point in the regulation?
Sorry, I had to take myself off mute here. No, so I'm not quite certain on this off the top of my head. I think we might need to take a look at this one just to make sure that we are giving a complete and accurate answer. Last thing I would want to do is take a guess here and provide something that's not accurate. So we'll look into that one and we can get back to you.
Okay, so Brian, if you want to send your email just by in the chat box, send it directly to the panelists. They can follow up with you. The next question is masks to be worn that are required to be, sorry, masks being worn are now required to be 3-ply. Just, I guess, clarification on that.
Yeah, so I believe that's the most recent recommendation in terms of making sure that the face mask is acceptable. That's my understanding.
Okay, and the last question we have here is, where would I find the most up-to-date passive screening poster, as I am having trouble finding one speaking to travel and being asked to self-quarantine?
So if Suzanne wants to send us her contact information, we can locate that for her and send it over to her if that's the easiest way to do it.
Perfect. So that that's all the questions we had. So I think we will try to wrap it up, and tomorrow we will send everyone a link to the recording of this so you can kind of watch it back and see the resources, as well as kind of the links that were provided today. So you'll know where to follow up if questions come up after today. But thank you so much to Stacy and Christina. We really appreciate your time. And I'm sure lots of people will watch the video in the future. So thank you very, very much.
Thank you guys. We appreciate being here. And sorry, I know we went over time, but it was great to have a chance to reach out to everybody.
Thank you.
Wonderful. Thank you so much. Take care, everyone.